There, Jaleisha just shared the YouTube link. There's the YouTube link with the lectures so far. All right, well, I'm getting everything set up here, guys. Someone want to let me know how clinic was yesterday? Anything interesting happen? Anything cool? Anything traumatic, scary, emotional, whatever? Or just any concerns you want to share? Well, I'm getting everything pulled up here. Nothing? Nothing at all.
The only thing that happened to me was that the operating room was pretty full. They were having like about a couple surgeries at the same time, and there was like very limited tech. So Chung was like running everywhere at the same time.
Tracy, are you driving?
No, sir.
No? Are you sure about that?
Yes, I'm just in my car.
Okay, just making sure. I don't want you wrecking or anything. It looks like you're driving. Please don't drive during class, guys. Please don't do that. All right, anybody else really quick? Anybody else have something cool? Anyone do a competency yet? Anything at all? Anyone try to do a competency yet? Oh, Ruth, you did? How'd that go? Tell us how that went.
It went good. When I got there early yesterday morning, I told her if we have any chest X-ray or lateral, I'm gonna come, and she said okay. And after 3 patients, and the fourth one was the chest X-ray, and she told me to set up the room. I did, and I went to pick up my patient, and yeah, I did everything, and she told me I did great.
So you got it. You did it successfully.
Yeah, that's why I look at it. It looks awesome to me. So I'm just
Very
waiting for
nice.
Mr. Fong to do it. To look at it again. So.
Very nice. Oh, he was there too?
No, 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 no. He wasn't there. I told him yesterday, so he's going to pull it up and see it and do the, how do you call it?
The image review. Yes. Very good. Very good. Great job, Ruth. Glad to hear that.
Yeah.
I was hoping someone was going to get something this week. So very nice. Well done. And on those image reviews, guys, remember, you can come to any of your 4 teachers. We're all available for those image reviews. You just got to let us know, and we'll schedule that for you as you get those competencies done. So don't feel like you have just one person to go to. We're all available to you. Whoever you'd like to go to do those image reviews, just let us know, and we will set those up. Good job. Very nicely done. Okay. Whew, 7:30, guys. Man, is anyone else feeling it? Yikes. At least it's Friday, yes. Thank God it's Friday. And I will say it is DEFCON 5 for me this morning, guys. You know why? I go into my kitchen to make some breakfast. I open up my coffee tin to make me some coffee. And the most horrible thing known to mankind occurred this morning. I was out of coffee. So I have not had my morning coffee this morning. In fact, it's such an emergency. My wonderful, beautiful wife right now has headed to Starbucks to get some coffee for us. So it's an emergency. This is a code blue emergency, guys. You know, Mr. Donahue did not have his coffee. So if I sound like I'm saying stuff that makes 0 sense, please let me know. Please let me know this morning.
Code blue.
My feelings. What, Ruth?
Code blue, Mr. John.
It is. If I do not have my morning coffee, it is a code blue. It's you may not see it right now, but there are cables holding me up. I'm not sitting up on my own volition right now. There's actually cables keeping me suspended right now, and I'm on autopilot, so. All right. Okay, let's go ahead and get started, everybody. Let me get our PowerPoint pulled back up. There we go. Okay. Yes, Leslie.
It says I need like permission from the host to record the meeting.
Okay, 1 second. I must have missed you. I'm sorry.
Please submit me to
Who was that?
Sung down. Sung.
Son, okay.
Thank you.
I need permission to, Mr. Donahue.
Who was that? I'm sorry. I don't have your faces pulled up. I'm just hearing.
Maricela.
Maricela. Okay, you guys should have the ability to record. Perfect. Okay. Here we go. All right, so we left off where I was showing you guys the way the operating room looks like, a little bit how that C-arm maneuvers, what that looks like for those of you who haven't made it to surgery yet. But we're going to continue talking about a lot of these things, as well as focusing on those aseptic technique procedures that you will see while you're out there in the hospital, and what we got to look for and make sure we're doing correctly when it comes to practicing good aseptic technique. There we go. Okay, so sterile field, guys. Well, we'll go to sterile field now. When we hear the word sterile field, that not only applies to surgery cases, which that's what most people are going to default thinking of when they hear sterile field, is that, oh, that only occurs in surgery cases. Not exactly the case. Sterile field actually applies to a lot more areas than just surgery in particular. Sterile field can even apply in an actual x-ray room. Sometimes when you're out there, there may be certain procedures performed in your x-ray suite, especially a fluoroscopy suite, which could be considered a sterile procedure. And anytime you hear that word sterile, you should light up and think automatically, well, I gotta be extra careful around this sterile field, because that sterile field is so very easy to break if we're not careful. But what is sterile field in definition? Well, that nice red phrase you see right here at the top. Sterile field is a specified area considered completely free of viable microorganisms, or as close to free of microorganisms as possible, because even though a lot of stuff will say it's 100% free, truly nothing is 100%. It's more like a 99.9% free of microorganisms, because like I said last time, that 0.1% of bacteria is actually considered good bacteria, but mostly free of those viable microorganisms that could break that sterile field and possibly cause infection or bad things happening to that person's body during that procedure. Now, what do we look for when we're talking about sterile field? Well, sterile supplies and equipment, and it seems like this would go without saying, but you'd be surprised how much this happens. They must be clean, they must be dry, and they must not be expired. You might be saying dry. Well, some areas of the hospital, especially older hospitals, develop moisture. Moisture can accumulate on anything. So if you ever see a supply out there, especially if you're working around a sterile field and it looks like it's moist or wet, you should chime in immediately, because that's considered not sterile. It should always be clean. If you see dust on it, if there is dust on any kind of supply, that is not a sterile supply. That should be removed and disposed of completely, because these supplies should be kept in a room where dust does not accumulate and where moisture does not accumulate. But every once in a while, these things do happen. And of course, not expired. Yes, every one of these supplies that we use, whether it be surgery, radiology, wherever, every one of these supplies have expiration dates. In fact, one of the things you may do as a student when you're out there in clinic is you might be asked by the techs every once in a while to look for expiration dates on equipment and supplies. Do take that seriously, because these things do expire, much like food expires. When that expiration date has passed, that equipment is not considered viable anymore. That needs to be thrown away and documented immediately. We're never going to use expired equipment, period. Now, also with sterile field, you'll hear the word sterile corridor thrown around a lot. What is a sterile corridor? That's the area between the patient drape and the instrument table. Essentially, that's where the OR nurse and the operating doctor is going to be standing during that procedure. In between that drape where the patient's draped and that actual instrument table where all those tools are sitting right there at the nurse's handing to him. That's that sterile corridor. Now, a big key here, guys, you should never, I'm gonna say it one more time, you should never find yourself walking anywhere near that sterile corridor. It's a very thin area, and not only are you apt to touching something accidentally, but basically even if you don't touch anything, if you're not covered properly, you're destroying that sterile field. It's a very tight corridor, a very tight space that needs to be kept completely free of those microorganisms. And some of those microorganisms might be on your clothes. Now, when you as a technologist are in surgery, you're never going to be covered like the doctors are or the nurses. You're not going to be in all that surgical get up. You're simply just going to have your lead jacket on and be running your C-arm with your surgical hat and your mask, of course, as well. But remember, you're not considered sterile. So if you see that sterile corridor, the best course of action is you want to stay as far away from that as possible if you can help it. Don't ever go near it unless you absolutely have to get an image and you have strict permission from the doctor to get close to that sterile corridor. Now, talking about sterile corridor, it also is synonymous with this area right here. A lot of times when you're walking through surgery, the hallways themselves are considered what we call sterile corridors. So don't mix that up because both those terms go hand in hand. A sterile corridor not only refers to the area between the patient table that's draped and the instrument table, but it also refers to that corridor that we travel within in surgery. So those terms do go together. They do refer to two different things, but they use the same terminology, unfortunately. And anyone going through those sterile corridors should be wearing the proper attire. One thing to remember, guys, if you're ever in a rush, and I've done this myself accidentally, no matter what, if you're anywhere near surgery, you have to have a hat and mask on. You must have a surgical hat and mask on. Don't ever find yourself running through there without a hat on. You're probably gonna get tackled by 5 nurses and doctors and thrown out of there really quick because you're gonna break the sterileness of that entire area. Very serious thing. Hair particles, hair comes out of people's skulls constantly. If you're like me and you're losing your hair, it comes out a lot faster. But we've got to make sure that hair is properly covered anytime we're going anywhere near those surgery departments. You'll often see some staff wearing bunny suits. Has anyone seen a bunny suit yet? A bunny suit is a white draping outfit that some people wear in surgery. Some surgery departments require the bunny suits, others do not. If it is required, that's something else you would have to put on before you go into that surgery area or sterile corridor, and we call those bunny suits. I don't know why exactly they're called bunny suits because it looks nothing like a rabbit except that they're white. They're these big white outfits that you have to put on that's going to cover up your body to keep everyone around you safe. Okay, so sterile drapes and packs. So to always obtain a sterile field in surgery, we're going to use what's called a sterile drape. Sterile drape is simply those blue sheets that you see draped over the patients. They're always going to typically cover every part of that patient with the sterile drapes, with the exception of the one area they'll be operating on. So if they're operating on a patient's shoulder, they're going to drape every other portion of that patient's body except the shoulder. The shoulder will be left exposed, but they're going to clean that area and sterilize it properly before they operate on it. Everything else will be covered by the sterile drapes so that we don't break that sterile field. Now, the first step, of course, is making sure that the package is sterile. You would think that goes without saying, but let's say you got someone that's reckless. You're standing there in a surgery case. You're watching them drape the patient. You see them remove a sterile drape package, and they accidentally brush the wall, or they brush someone standing next to them, like their body, or they brush anything around them with that package. Guess what? That package is now unsterile because it touched something. And you, as a medical professional, it's your job, even if they give you that stink eye, like, how dare you call me out on this? It's your job to say, hey, I just want to let you know that package just touched something that was not sterile, and that package is now non-sterile. We need to get a new one. That is your responsibility to watch out for these things. They may call you out on stuff if you accidentally hit it. Don't be offended. People should be watching for this because as human beings, we make mistakes. It is so easy to break sterile field, and it happens all the time. All the time. Of course, if you see a package that looks like it's been previously opened, sometimes these packages are slightly opened. We cannot use that package. That's considered unsterile. And of course, if it's expired, we cannot use that package, even if it looks like it's great, looks like it's fine. If it's expired, it is considered unsterile. Of course, not clean or dry like we just talked about. I put in there one more time, look for those expiration dates because you'll also be using sterile drapes, sterile wraps on your C-arms in the OR. They expire as well. You'll be carrying those with you. If you see that expiration date is up, do not use that. You can get in big trouble for that. It can be a big issue for the hospital. They can just get sued for that. So always look for those expiration dates. That's another key indicator that that package or equipment is not sterile.
Mr. Donahue, when would we bring it up about expiration? I know some places are like what, like 60 days, 30 days?
It depends on the equipment and the package. Every one of them have their own set time. Just like if you've ever worked in a grocery store, every different kind of food has different expiration dates. It's the same concept. And it'll say on the package, it'll say expired September 14th, 2020. It'll say very clearly on there. So you're gonna go all the way to the actual expiration day. You're not gonna do it like a few days before. So you wouldn't like remove it 5 days before the expiration date. It's considered viable until that actual day. So when you got to September 20th, you would dispose of that package and make sure you wrote it down. And every department has their own way of documenting that because they do have to keep inventory and track to make sure they order enough supplies. But that'll be one of your jobs as a technologist. Every once in a while, people will rotate and have to check for those expiration dates. Every one of you guys will have an opportunity to do that at some point. All right, here, guys, is a picture of someone opening up a sterile pack. Not the best picture. It's a very, very meticulous little procedure because you got to do it just right. Talking about sterile fields, it's so easy to break those sterile fields. And I actually have a video showing you what this looks like a little better. And this is something I'm going to demonstrate to you guys as well whenever we come to it, because part of your practicum is you're going to have to all do this sterile pack successfully. So essentially, when you're opening it, there's certain little tags on that sterile pack that you pick up. It basically labels it for you what to open first. As long as you're following the order it's labeled on that sterile pack, like you'll have a 1 there. You pull up the 1, bring it to the side. The 2, bring it over to the side. The 3, pull it over this way. The 4, pull it over this way. And you're going to do that in order to make sure you're obtaining that sterile field, not breaking that sterile field. Also, one thing this guy here is doing incorrectly is typically before you start opening this stuff up, you're going to be covered with more sterile materials, gowns, so on and so forth. Not always. Some people will do this barehanded like he's doing because you can technically do it with your bare hands as long as you're following the directions. But me personally, I always make sure I go ahead and have all the coverings so I don't break that sterile field. That's just me. But you will see it done both ways. But I'll show you guys how that works. I'm going to try to get that for next week and demonstrate to you on the camera so we know how to do that for our practicums. Still don't have a date for those practicums, by the way, but I'll let you know as soon as I find out when we're going to do all those. So this is a lot of the basic packs you guys are going to see, whether it be in surgery, whether it be in radiology. These are all used for various types of procedures. Main thing is they're colored blue. You see that color blue anywhere? That should be a clear indication, hey, that's something sterile. I need to be careful around it. There's a certain way that has to be opened, a certain way that has to be obtained and set up. I want to make sure I'm not breaking that sterile field at any point of anything that I'm doing. By the way, has anyone assisted dropping supplies onto a sterile tray before? Has anyone ever done that before? Duyan, you've done that before. What's the way that you do that properly? There's a very certain way that you drop supplies, because sometimes you may be asked, guys, and they'll ask you, can you open up this syringe for me? Why? If you don't do it properly, you'll break sterile fields. So Duyan, how do you properly do that?
Actually, like I just practiced yesterday. I went to the IR and then the tech just like hand me the thing, and then like they didn't let me touch the blue stuff, but they hand me the syringe and they said open it, but don't touch the inside of the packet. Just open it and just drop it like as much as you could, and don't get too closer to the table, because like they don't, even though like we don't touch the blue stuff, but like you know when you get in closer, like it might like yes, like the sterile stuff, like it much unsterile, you know what I mean?
Correct,
so
correct.
Yeah, that's what I did yesterday.
So right, so you guys will experience this, especially in IR. And really the best thing to remember is if they ever ask you to open a supply, all those little supplies are going to be in these little bags with flaps. You're going to pull those flaps open, and you always want to open it away from you, away from your body, over the tray. You're going to open the flaps and let that supply fall into the tray at about 6 inches. You never want to open the flaps of that supply, like if it's a syringe, for example. You never want to open it up and reach in there and grab it and pull it out. You just broke sterile field. To properly open those supplies over any of these trays or packs, you're going to open the flaps, let it fall onto the package, onto the tray. That's the proper way to do that. I'll show you guys how that works when I do the demonstration. Very important, because I don't want anybody reaching in there with their bare hands and pulling a supply out and say, here you go, here's a syringe or here's a scalpel or whatever you're using. And they're all looking at you like, you crazy person, get out of here. You just broke the whole sterile field. I got to start all the way over. Get out of here. They're going to be like Chef Ramsay cursing you out and saying, get out. True story. It's happened to me before. True story. But these are those sterile drapes, once again, guys, if you didn't know what I was talking about. Anytime you see those blue sheets over someone in surgery, those are referring to our sterile drapes. And just like I was showing you before, talking about before, they're going to cover every portion of the patient with the exception of that one area they're operating on. That will always be left exposed. You will see them clean that area with iodine. They will sterilize the area before they operate on it. It's a whole procedure of them washing that area, putting iodine on there, making it nice and clean so that when they operate, they cut the portion of that patient open. It's not going to break that sterile field. They're not going to let any kind of infections get in, and they're maintaining that aseptic technique overall. And of course, there's that C-arm one more time, guys. If you have not encountered these yet, you will at one point during your rotations. Main thing I wanted to show here once again, everybody, is make sure when you're going into these surgery cases, because sometimes your techs get in a hurry, they don't pay attention. You want to make sure that C-arm is always draped properly. There are specific C-arm drapes that go over your C-arms, and that's not only to protect your C-arm from getting all the blood and fluid on there, like I talked about that last time, how all the blood and fluids will get on your C-arm and you don't want to have to clean it off. But it's also protecting the patient, because you never know what's going to happen. That C-arm may slip away from you. It may hit the table. It may collide with something. Last thing you want to do, once again, is break that sterile technique by accident. They have to stop the entire procedure, start all the way over, and you're getting cussed out and thrown out of the operating room. And trust me, guys, speaking from experience, the last thing you want to do is go into a very stressful OR case. You're in a hurry because they called you, I need a C-arm here stat. They're doing a spinal procedure. Everything's set up. That person's cut wide open. You forget to put your sterile drape on your C-arm. You rush in there with the C-arm. You hit the blue sheets. All of a sudden, everyone stops, looks at you, throws a lot of F-bombs your way, and they have to stop the entire procedure and redo everything. And that person's cut wide open. I mean, everything's exposed. They got to start all the way over because you broke sterile field. Don't put yourself in that situation. Even if you're in a hurry, even if you're in a rush, even if you're being called stat, do what you have to do to make sure everything's properly covered so that you don't find yourself in that situation. And and I guarantee you guys, everyone here, at some point, you're going to break sterile field. Don't feel bad. It's going to happen. We're human. We make mistakes. We run into stuff. Own up to it. If someone acts and tries to tell you they've never done that, they're lying to you, because everyone's going to do it at least once. So don't feel bad about that at all. Just be careful. Look at your surroundings. Watch where you're going. And never, ever rush so much that you forget all those little details of things that you got to do personally to protect yourself and your patient and your equipment.
Mr. Donahue?
Yes. Oh, can't hear you, Jonathan.
Sorry, I was looking at that last picture, and the one where it was draped, and it looked like there was like a little section of it that's not draped. You see that? Is that acceptable?
Right here?
Yeah.
For me, no. For me, no. I'm glad you pointed that out. I would make sure that goes all the way up, but you will see some people leave little parts exposed like that. They'll say, oh, well, you know, that's going to be below the patient. That doesn't matter. Me personally, though, I would cover every part of it just to be on the safe side. But some techs will opt to do that, yes. That is considered acceptable. We'll put that in quotation marks, acceptable. But for me personally, it's not acceptable. That's more of a subjective thing. Yeah. You'll even see some techs, Jonathan, they'll leave this part exposed too, right here, the bottom part. I would never do that personally either, but some people will just cover that top part up here and leave the rest open. Me personally, I cover it all. Oh, and by the way, guys, make sure, this is talking about radiation protection. Make sure, guys, before you expose that C-arm, that you say you're about to expose that C-arm. That's another way to get cursed out really quickly, is if you get in there with your C-arm and you just start taking pictures, taking x-rays, all of a sudden every nurse and doctor is looking at you like, dude, what's the matter with you? I don't have any lead jackets on. and they're all getting mad and hollering at you, and everyone's saying, oh, I can never have babies now, my ovaries, oh, I've heard that before too. Make sure you communicate before you expose with that machine, because it's a fluoro machine. It uses a lot of high radiation. You always want to say, hey, everybody, I'm about to expose with the C-arm. If you need a lead jacket, or if you want to get behind cover, I'm about to expose. Make sure you're loud. Make sure you communicate. Don't just say, I'm about to expose. If you need to run away, run away. You got to be really loud, because those ORs get quite noisy with the music. There's a lot of action going on. Project your voice. Project your voice. Because I can tell you right now, even if you said it and they claim they didn't hear you, they're still going to blame you like, well, you didn't say it loud enough. Make sure you're loud enough. I holler it so that you can hear it in the next room. I say, I'm about to expose with an x-ray. If you need to get out right now. I'll say it really loud. Make sure everyone hears you.
Mr. Donahue, I have a question. Sorry to
Yes.
interrupt you. Is it common for the radiologist, the doctor, to not say that they're gonna expose? Because that's what I've noticed, that the few times that I'm in fluoro, like everybody's already protected, and you just see them pressing the pedal down, and they're just like, oh, save the picture, and that's it.
So you're saying, is it common for the doctor not to say anything? Is that what you said?
I've only heard it once.
Yeah, that's a sign of a doctor that just does not care anymore. Now, I've seen it both ways. I've seen some come in, just like you're saying, they'll just start exposing away, and you're just praying you have a lead jacket on. But proper procedure should be, they should say, everyone, I'm about to start exposure. Make sure you have a lead jacket on, or you're behind cover. That should be the proper way that's done. But you won't always find that. In that case, use a technologist, because they're not always going to say it for you. You want to chime in and say, hey, everyone, we're about to start fluoro. If you would like a lead jacket, or if you'd like to get behind cover, we're about to start exposing. So it's something to watch out for. I'm glad you saw that, because that does happen quite often. They don't communicate that. But you as a technologist, that is your responsibility to communicate that. So very good thing to ask, yes. Very good. Okay, so this is what I was just talking about, guys. When we're talking about dropping those sterile contents onto a sterile field to maintain that aseptic technique, we're always going to drop those supplies at approximately 6 inches. That is the limit. That is the highest you want to go. And obviously, guys, the main reason for that is, if I put that any higher, if I drop that supply any higher, what am I risking? I'm risking that supply falling and bouncing off the table. I just wasted a supply. If you know anything about medical supplies, they're quite expensive. Even if they don't look like they're expensive, they are very expensive. We don't want to waste anything. Always drop it approximately 6 inches above the field and at a slight angle to try to keep anything from bouncing off of that sterile tray. It's also going to help there's no reason you want to be at about 6 inches. When you're opening that wrapper is considered unsterile. And you don't want that to touch the tray accidentally. The only thing that's sterile is what's inside that wrapping. So as you open it, you don't want that to touch any part of that tray either. So we're going to maintain that 6 inch distance, drop it at that slight angle, let it fall on there, make sure it's not bouncing off that tray and staying where it needs to be. So be very careful if you have to do that, guys. And everyone here will have to do that at some point. You're going to have people constantly asking you for supplies. Make sure you're doing it properly and maintaining that aseptic technique at all times. And that's just another example right there, guys. That's that packaging I was just talking about. This is just some little sterile little wipes they're going to use for a procedure. It's gauze. You see that little wrapper I was talking about? You're always going to open that up very carefully. Let that fall at about 6 inches so it falls directly on that tray, and being very careful that wrapping does not touch anywhere on that tray. Now, this isn't blue. This is white. I always say watch out for the blue, but sometimes they're colored white as well. White doesn't mean that you can just go touching it either. That's still considered a sterile area. So no matter what color it is, make sure you're very careful when you're dropping those supplies. Do it properly. It's very easy to break that sterile field, a lot easier than it looks. And just to give you an example of what we're talking about here, guys, let me pull this link up. Can everyone see this? Everyone sees the video? Yes?
No.
Okay, hang on. That's why I was asking. And I apologize, guys. I'm typically not a person who likes to show YouTube videos because of how we're having to do this online. This is the easiest way to show you how this looks currently. I'm gonna try to give you a live demo as well when we get to it. Here we go. Can you see it now? Very good. I always find this video funny because this lady looks so happy about what she's doing. Like she just seems so excited about doing this. Let's see, wash your hands. You're always going to wash your hands first, just like we've talked about. No matter what you're doing, wash those hands. So she's opening up that kit, and that is considered an area you can touch where she's currently touching. That's okay, but there's a certain way we're going to unwrap that tray with the flaps. And sometimes they have numbers and they're labeled. Sometimes they do not. This one she's doing is not labeled. You're always going to be very careful opening up these flaps.
Mr. Donahue, they were asking in the chat, the video does not have audio, right? It's just...
Yeah, it doesn't. It's silent.
All right, thank you. Just going to carefully open up all those flaps without touching the inside. And just watch how she opens up these supplies, because you guys are going to be asked to do this. You're going to open those flaps very careful, then you're going to drop it on that tray. And see, I would argue, guys, you see what she just did there? I personally think she did that a little too high. That was beyond 6 inches. She's going to risk that bouncing off that tray. You want to be a little bit closer than what you saw there at 6 inches. That's just a brief demonstration of what that looks like, guys. That's something we're going to do live. I'm going to show you how it works. And it's something that you guys are going to have to do and demonstrate to me as one of your practicums when we get there. So everyone here will have to successfully do something very similar to that. Okay, so when we're talking about sterile fields, something else you guys may have to do at some point is pour sterile fluids into a sterile basin, depending on what the procedure is. There's a certain way this has to be done as well. When we're doing any kind of sterile fields into a sterile basin, one thing that we have to do as a technologist is confirm the name of the solution and its strength at least 3 times. That's a security measure to make sure we're using proper amounts of the fluid. Sometimes it might be a drug that we're using. And of course, we want to make sure we're applying this properly to not hurt our patients. So you're going to confirm the name of the strength, the name of the solution, and the strength of the solution at least, at bare minimum, 3 times. You might say, well, how do I confirm that? That's something you're going to actually do in the system, the computer system, using Epic typically. You've probably seen the text using Epic by now. When you're going through the order, you're going to put that information in 3 times, just confirming that you made sure you knew what you were using and the strength of that substance that you were using. Now, if possible, not required, you want to also confirm that with another person that's present. That's a backup for you should anything go wrong. You have someone else that confirmed that you did know what you were doing, use the proper solution amounts, the proper solution name, and that's just that little extra little security for you should anything go wrong. So something you're going to do, like you see in this picture here, is hold that bottle upward at an angle with that label uppermost, so that when you're pouring that solution, the solution doesn't come down and stain the label and obscure what it is, because if that is to happen, if any of that liquid were to get on the outside of that bottle and stain it, it would be considered unsterile. We can't read what it is. We're going to have to throw the rest of that away. And reiterating what I said, medical supplies are extremely expensive. Last thing you want to do is ever waste any of this stuff if you can avoid it. So be very careful if you're ever pouring those into those sterile basins. Sounds simple, but it's quite easy for that liquid to fall over the sides and actually stain those labels and mess up the whole bottle. So be very careful.
Be very meticulous with it. It's going to pay off and save you as well. So surgical scrubbing, not something that we as technologists will do very often, if ever. I think the only time you'd ever really do this is if you're in an IR case or certain other radiologic procedures. But rarely as a technologist will you ever find yourself doing this. But regardless, we do need to make sure we do it properly and we know how to do it properly. That's surgical scrubbing. Main thing, we have to, this is a requirement, remove all jewelry, including watches. You're never going to leave any kind of jewelry or watches on your arms or fingers. That would be completely breaking the aseptic technique, the sterile fill. That cannot be done, period, on surgical scrubbing. We're going to wash our hands and our arms, not just the hands, by the way, with a specialized antiseptic soap. You'll see this as you walk through surgery. You'll often see the surgeons outside the rooms with the big sinks. They're scrubbing their arms, their hands, getting themselves ready for those surgical cases. And they do always go all the way up close to their elbows when they're scrubbing, if you'll notice when they're doing that. We're going to clean the subfungal areas. What that means is that's directly under your fingernails. So you're going to scrub under those fingernails with a specialized nail file to make sure we're getting all those impurities out from under our fingernails. And then each side of the finger has to be scrubbed between the fingers, along the back and front of the hand. And this is all for a minute. Excuse me. It's not coronavirus, I swear. A minimum of 3 minutes, everybody. 3 minutes. So it's not the 30 seconds we're used to. When it comes to surgical scrubbing, that has to be done for a minimum of 3 minutes. That's a lot longer than it sounds, especially if you're washing your hands. Washing your hands for 3 minutes is quite a long time, but it has to be done at minimum for 3 minutes. And that nail file I was talking about here, this is what it looks like over here on the right. They'll scrub their fingernails with this little brush looking device to get under those nails and make sure they're getting all those impurities out from under there in that subfungal area under the fingernails. Boy, what a terrible idea to have a coffee-themed PowerPoint when you haven't had coffee in the morning. It's not working out so well right now. Okay, so back to about this surgical scrubbing, guys. We're going to scrub those arms, and one key point to remember as well, when they're scrubbing their arms and hands, and I want you to watch this when you go into surgery, they're always going to have their hands higher than the elbows. And the reason for that is if we drop our hands or arms down below our waist, if you remember, below the waist is considered a non-sterile area. We're only sterile if our arms are above our waists. We're going to do each side of the arm 3 inches above the elbow for 1 minute. So the hands themselves are going to get 3 minutes of dedicated wash time, but the forearms up to the elbow or close to the elbow are going to get 1 minute of scrubbing time. We're going to repeat that process for the other hand and arm, always keeping those arms above the elbows at all times. And by the way, I didn't say this before, when we're talking about 3 minutes, that's each hand. 3 minutes for each hand, 1 minute for each forearm. So each limb gets a dedicated amount of time. We're not talking about a total amount of time. So it's a long time you're washing your arms and hands. It is necessary for proper surgical scrubbing and for keeping that aseptic technique. Let me show y'all what that looks like right here. Let me get this pulled up. Now, y'all see what he's doing right there? I didn't mention this before. You see that device he's hitting with his elbow? That's for a very specific reason, because they never want to actually add soap with their hands. Why? Because they're scrubbing their hands and making them sterile. So you'll see little devices like that where they'll put their elbows on that little switch to make that soap come out. And I don't know if it'll show it on this video, but below them where their knees are, there's these little handles that your knees will fit into, and you'll actually turn the water on and off with your knees. Once again, that's to avoid exposing your hands and touching anything, because you're getting that surgical scrubbing done and completely sterilizing your hands and arms. And you saw there towards the end of the video, you saw how they were walking away from the sink with their hands up in the air. After they've done all that long process of scrubbing those hands and arms, and you'll see surgeons do this all the time, they're going to walk around with their hands up like this. Because at that point, they can't touch anything anymore. If they do, they got to start all the way over. So typically what you'll see is you'll see a nurse at that point come up to them and help them start putting the gloves and the gowns on because they can't touch it themselves anymore. So it's a multi-person job to get these people ready for all these cases. A lot goes into it. Don't worry. You don't have to demonstrate that to me. That's not one of your practicums, but we do need to know how that works as far as the processes go. That's not one of your practicums, thankfully, because that's actually quite complicated and time consuming to do. Okay. All right, that's just the process we just watched right there, all the steps of drying the hands. There's actually a process of drying the hands and arms as well. They're a pretty complex sequence in itself. Typically, you'll also see some people assist the surgeons with drying their hands as well. If there's a multi-surgeon team, there'll be somebody there assisting them through this process to kind of expedite it and move it along. But you can do it by yourself if you find yourself by yourself doing those hand washing and drying procedures. And then there's the surgeon putting the gown on. And this picture here does show them putting it on by themselves. Typically, in fact, I would say 99% of the time, they're not going to do that by themselves because there is a real danger of breaking that sterile field if you're trying to do this by yourself. You're almost always guaranteed to have someone in there helping you put these gowns on because it is so easy, especially once your hands and arms are completely sterilized. It is very difficult to do anything without breaking that sterile field, especially if you bring your arms down. And there is a certain process to putting those gowns on as well as the gloves. Now, as far as these gloves and gowns go, it's a little different than what I showed you guys in class last week when we were doing that little mini donning and doffing practicum. When it comes to doing sterile gowns for surgical process, there's a lot more to it. It's a lot more complicated. It's a lot easier to break that sterile field. And this is something you have to do for another part of your practicums. Everyone here will have to properly put on a gown as well as the surgical gloves without breaking sterile field. It's actually, even though it's a little difficult, it's kind of fun because it's pretty fun to see everyone mess up on it. We always laugh at each other while we're doing this because it's actually quite easy to mess this up and break that sterile field. It's something we have a lot of fun with, but it's something all of you will personally do and demonstrate when we get to it. Something I'll demonstrate to you guys as well. I'm hoping next week I'll be able to demonstrate it to you on camera, but I'm working on getting it worked out where we can do that in a live session as well. We'll have to do it live, period, for you to demonstrate it to me. We'll get there whenever we get the clearance to be able to do that. So one more video here, guys. Let me show you how the gloves work because the gloves always trip people up. If you'd like some granola as well, there you go. And some macaroni and cheese. You know, macaroni and cheese is a very, very important step for aseptic technique. Yes. Now, I want you to pay attention to that because when we do this in real life, one thing I don't like that he did there is he let that glove slide out really close to the table. When we're doing these sterile gloves like this, you're going to treat it just like a sterile supply that we just talked about over a tray, where you're going to hold it up at 6 inches and let it fall onto the tray as you peel open that package. So I don't want you doing it like he did on that video right there. That was a little unsafe. We'll actually hold that up 6 inches and let it fall onto the tray. I'll show you how that works when we do it in real life.
Mr. Donahue, does this video have audio?
I'm sorry?
Does this video have audio?
Oh, can you not hear it?
Well, it sounds like very faint.
Muffled?
Like, yeah.
Okay, 1 second, guys. Hang on. Thank you for letting me know. Tell me if this is any better. That's not better? All right, I'll get those audio things cleared up, guys. I apologize. I'll try to explain it as we go through it, though, if it's not making sense. So what he's explaining here, guys, is this area that's folded over the gloves, that's an area you're going to be able to touch with your bare hands. That's the only area of those gloves that you can touch with your bare fingers, because the outside surface of the gloves can be considered sterile. We don't ever want to touch that with our exposed skin. So you're going to see him only handling the inside part of this cuff with his bare hands. So you can see how he only handled the inside of that cuff. It's very important. He never, ever touched the outside of that glove at any point. That's the first step of that. So because that's a sterile glove now, he's able to semi-touch the outside of that other glove because he has a sterile glove on. He's going to put his fingers under that cuff. It's really important that you go under the cuff like you see right there in that picture as he starts to slide that onto the other hand. So now he's going to show you how to take them off properly, because much like putting them on, we have to take these off in an exact step-by-step process to make sure we're maintaining that sterile field and aseptic technique the whole time. So key point there, guys, he's always touching the inside of those gloves. So that's actually very similar to how I showed you guys last week when we removed those gloves on the donning and doffing. Removing those surgical gloves is quite similar overall, but putting them on is a different process. And that's something that we will all do together, because that's going to be one of your actual practicums you have to perform for me and be signed off on. We'll get to that whenever we're able to. Okay, so like you just saw in the video, guys, main thing to remember for sterile gloving is we're always going to pick that glove up by its inside cuff with one hand. We're never going to touch the outside surface of the glove or that glove wrapper. If we do at any point, both gloves have to be disposed of. We have to start all the way over. We're never going to be like, oh, we'll just go get me one more left glove. No, the entire package is considered unsterile. We've got to start all the way back over from step one, no matter what. So it is something to remember, because if you're one of those people who likes to take shortcuts, this is something we cannot take shortcuts on. If one area is ever exposed or touched and breaks that sterile field, the entire process must start all the way over from step one. Happens more often than you think. So we're going to slide the glove on the opposite bare hand, leaving that cuff down. As you saw when he had that glove on the right hand, he was able to touch the outside surface of the other glove because he does have a sterile glove on. But still, when he's putting it on that opposite hand, he's being very careful that only the inside of that glove is being touched by his bare hand at any time during that process. Being very careful not to break that sterile field. Always reaching under that cuff. Never touching the outside of that glove with his bare hands.
Or what you see most of the time is the surgical techs are helping them out, putting it on for them while they have surgical gloves on.
Good point. What Tracy was just talking about there is, remember when I was telling you guys when you're seeing a surgery case, the surgeons will clean their arms and hands and they'll be walking around with their arms up in the air. Most of the time there's going to be someone there assisting them. They'll actually help them put those gloves on, because the person helping them will have already put sterile gowns and sterile gloves on themselves. So they're considered sterile, can actually slide those gloves onto the surgeon for them without them having to go through this whole process we just looked at. But most of the time, if it comes to you guys doing one of these procedures, you'll have to be doing this by yourself. So you gotta make sure you know how to do this step-by-step process to gown and glove yourself properly. The main thing to remember, guys, your only area of those gloves you're ever allowed to touch or allow your skin to touch is the inside surface. Never at any point should you touch that outside surface of that glove. Otherwise, you got to dispose of both and start all the way over. But we'll be doing that in person. You'll actually get hands-on with that. You each get to do your own gloves. It'll make a lot more sense when you do it yourself. We always have a lot of fun doing it. It'll be really fun when we get to that very soon. Tracy's laughing at me right now. She knows what I'm talking about. So
very fun.
It is very fun. It is very fun. One big thing to remember here, guys, and not to say that you need to rat people out, but yes, you need to rat people out. If you see any possible contamination of a sterile glove, you need to bring it to that person's attention immediately. Will they get upset at you? Yeah, some may get upset at you. Some may be thankful, some may be grateful, but we don't notice things. So make sure you bring that up to somebody if you see them break that sterile field, because you could be saving a life, especially if they have any kind of bacteria or infectious agents anywhere on their hands that they did not previously know about. So let them know, communicate, make sure you tell people. I promise you, even if you get cursed out for it, you're doing the right thing. Okay, guys, we will stop right there today because I'm almost out of time. Are there any?
Hey,
Oh, yes, Tracy.
The 7 a.m. class ain't that bad.
Oh, it's not that bad?
Yeah.
I will echo that when I go get my cup of coffee here shortly. Yeah, because right now it's feeling pretty bad. Now, any questions on what we talked about today, guys? We'll be getting close to wrapping this up next week and getting close to our first exam. I know I've talked a lot about these practicums. Obviously, we can't do that in person as of yet, but as soon as I'm able to coordinate that, I'll let you guys know, and we'll get you signed off on each and every one of those practicums whenever the time comes. And just an update on that, I'm not speaking for the school because we have not had an official meeting yet, but I did see on the news that the governor lifted some of the restrictions this week, and they're allowing higher capacity in certain buildings. So that may happen sooner than we thought. but I'll keep you updated on that as it comes along. We'll be having a meeting on that next week. All right, guys, enjoy your next class. I will see you all at 10:30 for Rad Pro 2, where we will continue what we were talking about the other day. So see you all soon. Enjoy your class. I'll see you all in a couple hours. Goodbye. Bye.